那么人偏肺病毒呢，它并不是一种新的一种病毒，其实已经至少伴随人类几十年的一个时间。那么由于检测手段的这个发展，那么近年来呢，关于人偏肺病毒的报道呢渐多。那么目前呢，人偏肺病毒的整个的检测的阳性率呢，这个上升呢也是处于一个平台波动。那么其中北方省份的阳性率呢出现一个下降，我们也看到这个14岁以下的这个患者他的这个检测的阳性率呢开始下降。那么您刚才提到的人偏肺病毒、呼吸道合胞病毒都是引起冬季这个呼吸道传染病的常见病原体。那么感染以后的症状呢，主要是体现在那个出现发热、咳嗽、流涕鼻塞等这样的一些呼吸道的症状。那么大多数症状呢可自行消失，但是对于儿童、老年人以及免疫功能比较弱的这样的一些群体，那么它可能会引发这个下呼吸道的感染，但这两种病原呢，引起这个重症和死亡率都是很低的。
HMPV is short for human metapneumovirus. It's a very common virus that we've known about since 2001 and probably has been around since the 1950s. It's a very common virus that we see every year. Most children by the age of 5 have already had the disease. It's a virus that will produce symptoms like watery eyes, cough, sneezing, chest congestion. It's usually a very mild disease, but can in a very few people, especially those that are immunocompromised, could develop more severe disease like pneumonia. We've seen a spike, at least in several of the countries, including China, especially in the northern parts of China, a large number of cases of this. And this is very common because what happens is in the colder weather, colder climates, people come indoors and it's much easier to spread the disease, like through coughing and sneezing and touching objects that have been infected from people wiping their nose or their mouth. Well, what we want to know about it is that, this has been around since the early 2000s, or at least we've known about it, right? And it probably existed in the 1950s as well through this time. What we do know is that it generally produces a mild disease and occurs at the same time like influenza virus, respiratory viruses like RSV as well. So it's very hard to distinguish between those three without actually having a medical test. And for the most part, it is mild in people. There is no real treatment. There is no vaccine for this other than supportive care. So anyone having difficulty breathing should definitely see their doctor. In terms of prevention, good hand washing again, staying home if you're sick. If you have symptoms of coughing and sneezing, making sure that you're covering that, or wearing a mask occasionally will help with this as well. And then avoid contact with sick individuals. So it's really important that if you're ill, you stay home to prevent infecting other people, and other people can avoid you to keep themselves healthy as well.